What is Wellivery? Hi, I'm Dr. Tim Ryschon. Wellivery is the name of my telemedicine clinic. Wellivery is 100% online. Using this online method, my team can deliver phone and video-based encounters that focus on your current problem and chronic disease prevention. What makes Wellivery different from a traditional clinic? The biggest thing is a 100% focus on you and your current problem while considering your risk of future chronic diseases. I don't try to deliver emergency care. There are plenty of emergency rooms doing that. My clinic is based on national standards and the most modern methods of disease management. Wellivery uses online phone and video visits for maximal access and convenience. Wellivery visits are affordably priced and you can pay online, no insurance needed. To minimize treatment disruptions, Wellivery uses electronic medication prescriptions sent directly to your pharmacy. In the virtual clinic format, we use proven methods of online symptom assessment. Few medical problems can be addressed by a single visit, so Wellivery delivers follow-up visits to assure effective reassessment and control. And lastly, to give you a map for controlling your risk of future chronic disease, we give you a usable and continuously updated lifestyle action plan. Wellivery delivers everyday health for everybody. Everyday things like pink eye, urinary tract infections, skin infections, and the general health questions and concerns that just come up. We will deal with those swiftly and conveniently using our online approach. By everybody, I mean people with no insurance or those with a high deductible health insurance plan that makes them pay out of pocket. Your insurance status shouldn't stop you from getting quality care. More than everyday problems, though, Wellivery focuses on chronic disease prevention. While the focus on chronic disease, look, there are many problems facing all of us. Some immediately and some slow-moving and sneaky. I have spent 30 years learning about and treating them. Quite a few of these slow, sneaky disorders that roll into the ER stand out as being preventable. Asthma is one, heart attacks, certain cancers, and diabetes are others. Prevention and control of these diseases has been the topic of extensive research, which has led to the development of clearly defined prevention directions that patients and their doctors can follow. Despite these clear directions, though, chronic disease care remains poor in the U.S. Wellivery is my solution to that problem. Wellivery is built around well-defined national standards of chronic disease prevention. That means everything we recommend is state-of-the-art and based on evidence, science, and clinical practice. Wellivery leverages the smartphone and telemedicine methods. It's no longer acceptable to require you to come to a clinic when I can do everything that you need and I need to accomplish by voice and video. Delivering doctor visits by phone and video is way less expensive for me, which allows me to reduce the cost of the doctor visit for you. It's also more convenient for you, and you are exposed to less infectious diseases by avoiding travel and waiting rooms. At Wellivery, our goals are to provide consistent care, accessible from your smartphone, using quality strategies for prevention and control of your everyday problems and future problems that are based on national clinical guidelines. Let me and my team be your partner in getting control. As a reference for your learning, I've selected the most important concepts that I know you need to understand for optimal self-management and prevention, and I detail them at wellivery.com. You will also find Wellivery podcasts on Apple, Google, Spotify, and Stitcher, and videos on YouTube. And of course, the blog section at wellivery.com titled Wellivery Says will have updated information for you. And since neither you or I stop learning, I add new sections frequently, bringing you the most expert guidance available. Be sure to sign up in the subscribe box in the Wellivery Says section to receive email updates when I post new health information. Until we talk again, I wish the best of health to you. Thank you.